If you walked up to the door of your grocery store one night at 5 minutes after 10 and they said there's a fee for coming in because it's after 10 o'clock, what would you do? You turn around and walk away. What you don't know is a lot of you are inadvertently paying an entrance fee for getting to a hospital emergency room between 10 p.m. and 8 a.m. 99053. This is a code that, it is a legal code, it is a legitimate code. It's not one I've ever paid, and I'm a payer. I've been managing employer health plans for 22 years. But don't pay this code. They may give you a little bit of a hard time, but at the end of the day, they will write this code off. It's for services provided between 10 and 8 at a 24-hour facility in addition to basic service. Now, my problem with this code is that emergency room is there. The doctors are paid, the nurses are paid, the power bill's paid, the equipment's paid for. They are incurring no extra expense for you walking in that door at 5 after 10. None whatsoever. This is just a code that, the American Medical Association or Hospital Association or whoever does these codes came up with, and since the government is virtually bought and paid for, nobody pays it any attention. But Medicare doesn't pay it, and most insurance companies don't pay it, and we certainly don't pay it. I ran this report this morning, and this is just one of my clients, and it's a small time period. And you'll see 99053. These are NPI numbers and stuff that I can't show you. And 5 of them total $1,530. The lowest charge was $306. The highest charge was $306. This is one facility, so you can see that the lowest charge is $96, and then the highest one is $306, and it's all different facilities. Still a lot of money for them not incurring any extra cost. And here's the real kicker. They get to choose when the clock starts. They can choose when you sign in, when you get to triage, which is when they decide whether you're going to see a doctor or a nurse, and when the physician sees you. So, let's say you get to the emergency room at 8 o'clock in the evening. You sign in, it's 10:30 when they get you to triage, and that could be a short wait. They can still tack on that 99053 because that's when they set their policy to start the clock. Or once you get to triage, it's probably another hour or so before you see a doctor. So now it's 11:30, 12 o'clock, and that's when the clock starts. That's when they add that 99053 code on there. It's all a racket, and it's designed because they know people do not understand what's going on. You've got to get control of your healthcare costs, because if you don't get it, it ain't going to get got. Think about it this way. The average number of ER visits per year in the U.S. is 1.5 million. The average charge, based on what we just saw on my information, is about $200. So if all hospitals charged 99053 and they were all reimbursed for that code, that is $31 billion that Americans pay just because they got sick after 10 o'clock at night. Makes no sense, but since there's no regulation on the healthcare industry at this point, it can happen. Don't be a victim of that code. You don't have to be. Even if your insurance applies it to your deductible, you go back and fight it. There's a free template. I'll put the link in the description. If you have to fight this code, it's a template for a letter. You just fill out your information, copy and paste it into a Word doc or whatever you use. Insert your information, send it. Send it certified mail or priority mail. Make sure you have a receipt so they can't say they didn't get it. Follow this channel, hit that like button, turn on the notifications. I'm here twice a week at least, and every video will be some sort of cost savings measure for your health insurance. I'm sick and tired of seeing good, hardworking people get sent to collections or face financial ruin by a corrupt healthcare system, and that's exactly what we have in this country. I'll see you in the next one. Have a great day.